Hello everyone, welcome back to our channel. Imagine a better world where everyone can deadlift. Deadlifts are a highly effective compound exercise that targets multiple muscle groups and provides numerous benefits for individuals of various fitness levels. In today's video, we're going to dive deep into the world of deadlifts and explore their various variations, techniques, benefits, muscle activation, and more. But before we start, if you are not subscribed to our channel yet, we kindly ask you to consider subscribing to our channel, giving this video a thumbs up, and sharing it with your friends. Your support helps us continue creating valuable content. So, let's get started. The first deadlift variation we'll discuss is the conventional deadlift. It's the most common type you'll see in the gym. The technique involves standing with feet hip-width apart, gripping the barbell just outside the legs, and lifting it from the floor using a hip hinge motion while keeping the back straight. The benefits of the conventional deadlift are immense. It primarily targets the glutes, hamstrings, and lower back muscles, while also activating the quadriceps, calves, forearms, and core. This exercise enhances overall strength, power, posture, and grip strength. Muscles activated during conventional deadlifts include the gluteus maximus, hamstrings, quadriceps, erector spinae, trapezius, rhomboids, latissimus dorsi, and the core muscles. Athletes use conventional deadlifts to improve their performance in strength and power sports, like weightlifting and powerlifting. Elderly individuals can benefit from maintaining lower body strength and improving balance. Rehabilitation patients can use this exercise to strengthen their lower back and correct muscular imbalances. However, it's crucial to perform the conventional deadlift with proper form to avoid injuries such as lumbar disc herniation or muscle strains. Beginners should start with lighter weights and gradually progress. Now, let's move on to the Sumo Deadlift. This variation involves a wider stance with the feet pointed outward. The lifter stands inside the barbell, gripping it with hands placed between the legs, and lifts the weight by extending the hips and knees. Sumo deadlifts target similar muscle groups as the conventional deadlift, but with some variations. They place more emphasis on the glutes, quadriceps, and adductor muscles. Sumo deadlifts can be beneficial for individuals with long legs or limited hip mobility. Muscles activated during sumo deadlifts include the gluteus maximus, quadriceps, adductor magnus, hamstrings, erector spinae, trapezius, rhomboids, latissimus dorsi, and the core muscles. Athletes in powerlifting competitions often use sumo deadlifts, especially those with longer limbs or limited hip mobility. This exercise helps improve strength, power, and performance in sports that require a strong lower body. Elderly individuals and rehabilitation patients may need modifications and professional guidance. It's important to note that sumo deadlifts may place additional stress on the hips and knees, so caution should be exercised, particularly by individuals with pre-existing issues in these areas. Lastly, let's discuss the Romanian deadlift. This variation focuses on a hip hinge movement pattern while maintaining a slight knee bend. The lifter starts with the barbell in front of the thighs, maintains a neutral spine position, and lowers the weight by hinging at the hips while keeping the barbell close to the body. The RDL primarily targets the glutes, hamstrings, and lower back muscles, with less emphasis on the quadriceps. It's an effective exercise for developing hamstring strength, hip hinge mechanics, and improving overall posterior chain flexibility. Muscles activated during Romanian deadlifts include the gluteus maximus, hamstrings, erector spinae, quadriceps, calves, trapezius, rhomboids, latissimus dorsi, and the core muscles. Athletes use RDLs to improve hip extension strength, hamstring flexibility, and overall posterior chain development. Elderly individuals can strengthen their posterior chain, improve posture, and enhance balance. Rehabilitation patients can benefit from correcting muscle imbalances and improving hip mobility. As with any deadlift variation, maintaining proper form and a neutral spine position is crucial to minimize the risk of injury during RDLs. Now, let's talk about the impact of deadlifts on metabolic processes with some lesser-known facts. Deadlifts, being a compound exercise involving multiple muscle groups, significantly increase energy expenditure during and after exercise. They stimulate the body's metabolic rate, leading to increased calorie burning and potential fat loss. Deadlifts also stimulate the release of anabolic hormones like testosterone and growth hormone, which contribute to muscle growth, repair, and overall metabolic function. They trigger muscle protein synthesis, essential for muscle growth and repair, leading to increased muscle mass, improved body composition, and metabolic health. Deadlifts elicit a significant afterburn effect called the post-exercise oxygen consumption. The body continues to consume oxygen at an elevated rate, resulting in increased calorie expenditure even during the recovery period. Regular deadlift training, along with proper nutrition, improves insulin sensitivity. This helps the body efficiently utilize carbohydrates, regulate blood sugar levels, and potentially reduce the risk of metabolic disorders like type 2 diabetes. That wraps up our comprehensive analysis of deadlift variations. We explored the conventional, sumo, and Romanian deadlifts, their techniques, benefits, muscle activation, impact on different populations, risks, recent studies, and even the impact on metabolic processes. Remember, deadlifts are highly effective exercises, but proper technique and gradual progression are essential to minimize the risk of injury. Whether you're an athlete, an elderly individual, or a rehabilitation patient, deadlifts can be tailored to your needs. If you found this video informative, don't forget to hit the like button, subscribe to our channel, and share it with your friends. And as always, consult with a fitness professional or healthcare provider before starting any new exercise program. Thank you for watching, and we'll see you in the next video.